When you pee, you'd dab, yeah? If you look at the anatomy of the reproductive system, the external genitalia, yeah? So the urethra is above the opening of the vagina. Where you pass urine is above the opening of the vagina, and the anal region is below. So look at it like 3 holes, yeah? Aligned, yeah? But in very close proximity to each other. So when you pee, you're likely to just dab yourself with something and with tissue and throw it away, right? When you're wiping, because you've gone to the bathroom for a long call, then you need to wipe from front to back. The whole point is the poo has organisms, yeah, that can cause infection, yes. So then if you wipe from back coming to the front, yeah, where the opening of the vagina is, then you're transferring microorganisms, yeah? You're transferring the pathogens from the poo to the vaginal opening. And then you get what we call ascending infection. These organisms are able to travel into your vagina and cause infection. They're able to travel into your urethra and cause infection. So that's the whole point of saying wipe from front backwards. It's just to avoid transferring organisms from your poo back to your vagina and to the urethra. Yeah.
Okay. Washing.
Yeah.
What do we need? Do we need, okay, the Femi-Freshes and all of this?
Now, what we say about this is, like I mentioned earlier when the show was starting, the vagina cleanses itself. You do not have to douche. You do not have to put a pipe inside the vagina or whatever it is. The products come in different forms, yeah? You do not have to insert anything to splash your vagina or to do anything there. All you need to wash is wash the outside. Yeah, yes, clean your outside. Warm water, just clean your outside, but you do not have to insert anything. You do not have
The products I'm referring to are like special shampoo, which we are told will restore the pH or will ensure that the pH of that region is balanced.
No, we avoid, you know,
or the correct pH.
Yeah, the vagina cleanses itself, so we avoid using products in the vagina. There's no special shampoo, special soap. We advocate for non-fragrance soap when washing down there, but what we are saying is when I refer to down there, I mean the external genitalia. I do not mean that you wash the vagina, yeah? It's like saying, look at it like your ears, yeah? So look at it as if your ear is the external genitalia, it's the outside. So I'm saying wash outside here, wash your pinna. But I'm not saying, so assume the ear canal, yeah, is the vagina. So I'm not saying get into the ear canal and start cleaning it. So if you use that analogy, yeah, so bring it back to the table. Wash outside, non-fragrant soap, just warm water, just wash outside there. But then nothing should go inside your vagina. It's able to clean itself. I think people are struggling with that conception that your vagina can clean itself, and it comes back to what she said, that the societal pressure, everyone is like, I think to sustain a relationship, to sustain a marriage, there are all kinds of things. Someone wants to put a strawberry scented item in there. Literally, your vagina does not need anything. It has glands. The cervix has glands. It produces substances that are able to cleanse the whole tract coming out. Yes, so then you do not need to use shampoo, a special shampoo in there. You do not have to use special wipes for your vagina. No. All we are saying as gynecologists is wash the outside. The vagina will cleanse itself. You do not have to insert anything or spray it with water or splashes, no.
But you know, there are certain situations. There are two I'm thinking about off the top of my head. One, that time of the month. Is the protocol the same?
Yes. That time of the month, actually the epithelium that she was talking about, Dr. Netley was talking about, is very vulnerable, yeah? And also the blood that is coming out can be a needles for infection. Let the blood flow, yeah? So if you're using a tampon, ensure you change regularly. If you're using a pad, change it regularly. But you do not need to insert anything to clean the vagina when you're on your periods. The blood flows out from the uterine wall that is shedding all the way through the cervix to the vagina. It flows out by itself. You do not have to splash the blood out. You do not have to wash it out. Yes, the uterus has a way in which it will propel that blood out. It will ensure we have a one-tract flow unless there is an obstruction for one reason or another, but actually the blood should be able to flow out. You do not need to use special routines or special cleaning mechanism. All we say during your menses is ensure proper hygiene. Because if you stay with the pad for 12 hours, 24 hours. That blood that is there is also, like I've said, a nidus for infection. It's like a good medium where bacteria grow, yeah? And so if you stay with these tampon pads for so long, you're putting yourself at risk of getting infections. But then it doesn't mean you start douching, washing the vagina. No, just maintain normal general hygiene and hygiene of the perineal area.
All right. Well, I may not be inserting or splashing water inside. There's the outside, and then there's the opening. What do I do with the opening?
The opening, you know, I wish there was a diagram I would illustrate for you.
let me pull up.
I think because people are able to Google, let me use the right words. There's the labia. Yeah?
Yes.
Yeah. So then, if you look at the female anatomy on the outside, you have. I'm trying to get the right word that also will be acceptable and at the same time very basic and not derogatory. They're like two flips. Yeah. So they're huger flips on the outside, what we call the labia majora. I think you're almost getting a diagram.
I
think the fifth diagram.
The fifth, 1, 2, 3, 4. This one? Here. This one or the other one?
I think the diagram on the side where you are should do.
Okay.
I don't know what's on it. I can't see it clearly from my end.
Okay, don't worry, I'll figure it out. Go ahead,
okay.
Go ahead.
So then as you get it, so you have labia majora, you have labia minora. These are like folds, yeah? But remember, these are folds that also have glands on them, yeah? So what we are saying is clean the outside. These flips cover the opening that we were talking about. It covers what we call the introitus, the opening to the vagina. So then it's like a protective mechanism also, yeah? So we are saying don't find a way, if you're patting them, you're patting to just splash warm water around that area. But we are not saying pat them so that you start rubbing them with cloth and soap. That's not what we are saying here. Warm water is adequate. Just splash water around there. Now, in between those flips that I'm talking about is the opening of the vagina. Nothing should go beyond that opening in terms of washing. No serviette, no soap, no shampoo, no water being splashed inside there. Yes, because different people have different products that they come with to the clinic just to show you and ask you, Doc, am I using the right thing? But honestly, when you look at it, it's something that she's been told to insert in the vagina to clean the vagina. No, I'll overemphasize this, that the vagina cleans itself. All you need to wash are the flips outside there, yes? The places, I don't know, I would explain it better with a diagram, but I think you get my point.
Yeah, I'm trying to find a PG image. I'm not entirely sure what, but this one looks safe enough.
That's inside. Okay, so maybe we can use this.
Okay, this is the inside.
Just scroll it up a bit. So you realize what we are saying is, just to get back to the initial question you had asked me, like if tampons can get lost or something, the tampons land there where you see written vagina. Like it's like a canal, yeah? So it lands there. It doesn't go beyond the cervix unless you're intentionally pushing it through into the cervix. So it won't get lost. If you forget it and you get to see us, we just do what we call a speculum exam and pull it out, yeah? Okay. A very simple exam and just get it out for you. Let's say you forgot it or you're having this discharge and we want to look at it and then we find a foreign body there. But then the flips that I'm talking about, this is an image of the internal reproductive system, yeah? Okay. What I'm talking about is outside. So
I don't know whether there's a fruit I can find that can kind of like depict.
It's okay. But this uterus, cervix, vagina does not need cleaning. Whatever you're seeing on the screen right now does not need cleaning.
Okay.
Yes.
Okay, so I said two instances, two special instances. After the intimate act.
Yeah.
Yeah.
So after the intimate act, we advise that you go to the bathroom and pee. That is the first thing. Pee after having coitus. In medical terms, we call it coitus, like after having sexual intercourse, go to the bathroom and go for a short call. The reason we are saying this is during that act of penetration, foreplay, and all that, you can introduce bacteria to the urethra. Remember I said look at it like three openings in close proximity to each other, that you can introduce bacteria to the urethra, and that's why you need to pee so that whatever bacteria had got, let's say, to the opening of the urethra can just be flushed out. That's the first thing. The second thing is you do not have to wash in there. Yes, you just wash outside. Yes, whatever it is, Now, it depends also, were you using a barrier or not? Yeah, I'm assuming that if you're not using a barrier, then, and if it was not withdrawal coitus, then it means the sperm are in and you wanted them to go in. So you're not trying to wash out sperms, yeah? So then what happens is once you've had coitus, and we are talking about consented coitus, so once you've had coitus, then you wash outside. There is no reason for you to splash anything into your vagina for any reason, yes. Whatever it is will flow out. Whatever secretions you had will still flow out. Do not introduce things into the vagina. And these are some of the issues that are bringing the recurrent infections. These are some of the practices that bring, because someone feels like, maybe if I splash soapy water inside there, I'm cleaning the vagina of any bacteria. No. You're actually making us lose the normal flora, the normal bacteria that is there, then making yourself susceptible to infections. Yeah.
Okay.
So then after coitus, wash outside. Pee, wash outside, don't wash your vagina.
Okay.
Yeah.
Steaming. Are we supposed to steam?
What are you steaming? Are you steaming your face or you're steaming
I've
your
never
vagina?
done it, I don't know. But
no, when I say you,
yeah.
I say in general, the people you're asking the question on their behalf. So you don't steam. We do not advocate for vaginal steaming. I know there are practices that more or less like commercial things, like the things we are dealing with right now, yoni pulse and all that. I want to make my salon sell better. I want to have varied products. So come for vaginal steaming. It literally has no health benefit to you. You do not have to steam your vagina for anything. It does not make your epithelium better. It does not make the tone of your vagina any better. It does not change anything in terms of your reproductive tract system. We do not advocate for steaming, yes.
Okay.
If you're feeling uncomfortable in any way, if you're feeling itchy and that's the reason you're thinking of steaming, if you're feeling uncomfortable, that's the reason you need to see your gynecologist, not to go for steaming, yes. Steaming, we do not advocate for steaming of the vagina, yeah.
Okay. Somebody is, I'm sorry, I'm being asked by my director that when somebody has given birth and I'm assuming stitches and they're told to sit in water with salt, hot water, is it hot or warm water with salt?
Yeah.
Is that okay?
So what we do nowadays is, remember this practice, how it started was, it's just an attempt to soothe the area, yes. But then how many houses have these special baths for women to sit on? Most of the women, you'll realize they're struggling with a basin, yeah? Imagine having given birth, sustained tears down there, and then you want to struggle, put your bum in a basin, yeah? Most households in Nairobi or even in the village, who has bathtubs in the village, you know, all those kind of things. So then we advocate for washing there with warm water. Just wash that place with warm water, yeah, and maintain your hygiene. And the doctor will also be able to assess, whoever like carried out the delivery, the gynecologist will be able to assess the extent of the injury, and if we need to do what we call empiric treatment also, yeah, to cover you, to protect you from getting infections and all that. But then splash that place with warm water. Just warm water is adequate, because sometimes what we encounter is in attempt to fit and sit, you end up loosening our stitches. Yeah, the stitches give way. So we just advise stand in a shower, splash that place with warm water. If you have the telephone showers, yeah, just splash the outside there with warm water. That's all you need, and pat it dry. That's it. Yeah.
Sorry, I didn't catch that question. Sorry, the questions are coming through SMS and.
I get you.
The what? The what? Oh, okay. Lubricants. Are they safe?
So for the lubricants, I'm assuming whoever is asking about the lubricants used during sex. Yes. So we advocate for water-based lubricants. Yeah. These are lubricants that are, and when you buy a lubricant, it should be indicated, yeah, that it is water-based lubricants, and also it should not be scented. Yeah. So when you're having, because that is the issue we are having. You're having multiple products in the market, yes, vanilla scented, strawberry scented, and these are the issues that's causing us these recurrent infections that we are dealing with, that's making people go for unregistered things like yoni pulse, yeah? So then use water-based lubricants that are not scented. Yes, okay. That's what I can say about the lubricants.
All right, and why am I forgetting this question, somebody? If you can just remind me. Yes, the smell.
Yeah.
Does what I eat
come through your vagina?
It affects how it smells? Because somebody shared something with me on WhatsApp, something called miski, some sort of fragrance for the area. I can forward it to you. Let me forward it to you. But does the food I consume affect, I've said it to you, but does the food I consume affect how I smell down there? And if I want to change the smell down there, what can I do?
Okay.
Assuming it's not a foul smell. I don't even know if it has a smell. Is it supposed to have a smell?
I think, no. There's a natural scent. Yeah. Everyone has a natural odor.
A mask.
Yeah, yeah. There's a natural scent to everything. And I think what you've shared with me are these, from what I've seen, they're like perfumes. Yeah, like these are small bottles of perfumes.
Yeah.
So this is coming from a point of view that we are in a very patriarchal society. Yeah, and we have different reasons for doing the things we do. But the bottom line is, you do not have to splash anything down there or spray down there to smell different. Yes. You can use your scents on your clothes. Fine. Use your scents on your body the way you spray your perfume if you want to mask your natural odor. But then you do not have to spray anything on your external genitalia or on in your vagina in attempt to mask the smell. That place has a natural odor that usually blends with your odor itself, unless you're having a foul-smelling discharge. Yeah, unless there is something that is off for which you need to see a doctor.
And that is something you would notice.
And that's something you'd notice, yeah. But otherwise, you do not need to splash perfumes on your vagina or on your external genitalia for any reason. If you feel like you want to smell vanilla today, splash your body or use a body splash on your body, but not down there. Okay. Yeah, and I think this is coming from societal pressure. Okay,
yeah. Really, really quickly, 10 seconds. Cranberry juice for UTIs?
Yes, we prescribe them, yeah. But remember, if I say if I give you an open check, and that's why we are having recurrent UTIs, you'll get a product that is written cranberry, and inside it you do not have cranberry. Yeah. So like I mentioned earlier on, we have natural products that have been shown and research has been done and shown to be safe. But then allow us as your doctors, allow us as your gynecologists to be the one to prescribe these products for you. Because then I'm able to control what exactly am I prescribing. Is it registered or not registered? Please do not prescribe these things for yourself.
Okay. Yeah. So I will have Dr. Rita back. I will compile these questions. There are so many. I'm sorry, I can't go through all of them. They've been feeding me through the phone and through my ear. And the one for pineapple to help that area smell better?
Like
or smell nice, I don't know. Pineapple as a fruit for the vagina?
No.
Eating, consuming a lot of pineapple.
Consuming a lot of, I thought inserting pineapple.
Oh, no, consuming pineapple?
No, I haven't read research that shows pineapple is good for your vagina. Yes, unless it's a study that's coming up that we need to look into, but I haven't come across that. So maybe you eat it for the nutritional benefit, but nothing to do with your vagina. Yeah.
All right. Aya, mmepata majibu.